Hi there, my name is Matthew Harris, and today I will be presenting on my client Tony, who has suffered a spinal cord injury. Tony is 21 years old and suffered a T3 spinal cord injury in 2020 while riding his motorbike. He is diagnosed as Asia B, with sensory function below the level of injury but no motor function. He has also recently reported pressure sores on his left hip, requiring him to adjust regularly to minimize damage. He also suffers from episodes of autonomic dysreflexia, and as such has been prescribed GTN spray to manage these episodes. He's also prescribed baclofen as a muscle relaxant. This indicates that he has developed spasticity below the level of injury, likely in the lower limbs, including adductors, knee flexors and extensors, and plantar flexors of the ankle. Tony is able to ambulate in a manual wheelchair and is also able to transfer independently with supervision. He lives at home and is cared for by his parents, who have a limited understanding of English. As such, we would like to inquire with him about his ability to translate and explain to his parents, as well as questioning if he has any other form of care. Tony has come to us with the goal of increasing upper body strength and endurance to assist in wheelchair pushing, as well as increasing lower limb mass using technology. He would also like to play wheelchair AFL in the future, and as such, our prescription will assist in developing these skills. Tony suffered an incomplete spinal injury at the T3 level. As we can see from this image, he suffers from paraplegia with loss of function from the chest and back, just under the armpit and below. He is classified as Asia B, with preserved sensory function below the level of injury, but no motor function. As a result of this, Tony has developed autonomic dysreflexia. This is a common occurrence in patients with spinal cord injuries at the level of T6 and above due to a loss of normal autonomic and cardiovascular control. Episodes of autonomic dysreflexia can occur due to stimulus below the level of injury, most commonly in the bladder, gastrointestinal tract, or skin, and causes blood pressure to increase dramatically. The body has no ability to naturally control this increase in blood pressure due to disruption of descending vasomotor pathways, and if not treated, can lead to stroke, cardiac arrest, and seizures. Tony has also began to notice pressure sores developing in his left hip. This is a common occurrence in people with spinal cord injuries, particularly those who are confined to a wheelchair. Pressure sores occur over bony areas of the body where there is a large amount of pressure and tissue distortion, and occur commonly around the hips in patients with spinal cord injuries due to the significant amount of time spent sitting in a wheelchair. These can often go unnoticed due to motor and sensory changes, causing the sores to worsen over time. There are a number of clinical goals we have set for Tony based on his initial concerns as well as his aims in coming to see us. The first goal area we would like to address involves his cardiovascular fitness. Initially, we'll use a 6-minute wheel test to track this with the aim of increasing this distance by 75 meters in 6 weeks. By the end of this 6-week period, Tony will have developed a greater tolerance for aerobic exercise and will more likely to be capable of performing maximal aerobic tests using the arm ergometer. As such, we would like to develop a baseline predicted VO2 score at around this 6-week stage. This then leads us into medium and long-term goals focused on improvements in predicted VO2 max during maximal arm ergometry tests. The goal is to see an improvement of 5% in the first 3 months, with research conducted by Helgerud et al. In 2007, showing improvements of 5.5 to 7.2% in an 8-week period. This then progresses into improvements of 25% within the 12-month period, with research conducted by Wen et al. In 2019, showing improvements of negative 5.4 to 33.1% VO2 max during long-term HIT programs. Our second goal area aims to improve Tony's level of independence in transfers and other important activities of daily living. In the short term, the goal is to increase his spinal cord independent pressure score to 77 within 6 weeks. This is shown to be achievable with research by De Oliveira et al. In 2019, showing significant improvements occur in the early stages, with mean improvements of 4 points within a 12-month period, as evidenced in the long-term measure for this goal. The third goal area for Tony is improving lower limb muscle mass using technology. This is done using functional electrical stimulation with research conducted by Atkins and Bickel in 2021, as well as Skerman et al. In 1999, showing cycling and resistance training with the use of FES creates significant improvements in muscle mass shown using DEXA imaging. Research conducted by Sana et al. In 2025 showed a 34% improvement in lower limb muscle mass with a 6-month FES cycling program. Further research conducted by Skerman et al. In 1999 showed muscle mass increases of between 20 and 72% over a 12-month period, providing a guide to develop relevant clinical goals from. Initial outcome measures are important to gauge Tony's capacity for exercise, as well as providing us with indications of his overall health status to prescribe from. Tony's BMI and waist circumference are both slightly above recommended cutoffs specific to patients with spinal cord injuries. Tony also presents with a low blood pressure reading. This is consistent with his diagnosis of autonomic dysreflexia, putting him at a high risk of hypertensive events occurring. He also presents with healthy resting heart rate. However, due to his lack of autonomic control, he is likely to present with increased heart rate variability. When looking at Tony's exercise capacity, his 6-minute wheel test score is above the mean score of 280 for patients with paraplegia, as discussed by Bice et al. In 2015. It is worth noting, however, that these mean scores are for patients with the average age considerably higher than Tony. He's also indicated that he would like to play wheelchair AFL, which would require a much higher level of fitness and ambulance in comparison to most with similar injuries. Tony's combined score of 111 between both arms in the grip strength test is indicative of functional independence in men with spinal cord injuries, according to research by Neto et al. In 2021. When looking at independence measures for Tony, there are significant gaps in research in regards to injuries similar to Tony. When looking at the modified Rivermead Index, Tony's score of 17 places him below the cutoff score for functional independence, according to Lim et al. However, this research is conducted in relation to stroke patients, and there is limited evidence to the crossover to spinal cord injuries. On the contrary to this, Tony's score of 75 places him above the median score for independence with patients with T3 injuries. Whilst this research is conducted in patients with complete injuries, this is likely to be relevant to Tony as he has no motor control below the level of injury. There are several additional measures that we would like to undertake with Tony. It is so important to track progress in relation to his goals, develop a greater understanding of his condition and capability to ensure safety, as well as providing us with baselines to prescribe from. We would like to perform DEXA scans with Tony on a regular basis, as this provides us with key information about his muscle mass, linking to his goal of increasing muscle mass in his lower limbs using functional electrical stimulation. We would also like to perform some balance testing with Tony to get an idea of his ability to hold himself in position, as well as correct himself when necessary. According to research by Jorgensen et al. In 2011, the motor assessment scale balance sitting component is relevant to this. On top of this, strength testing is important for Tony, particularly in the shoulders and upper body movements. This allows us to get an idea of specific areas that he is weak in, as well as give us a baseline to prescribe from. Tony's use of baclofen gives an indication that he has developed spasticity since his injury, likely in the lower limbs. Assessing this with the modified Ashworth scale is important with research by Diaz et al. In 2021, showing this gives us important clinical information to prescribe from, as well as allowing us to implement important safety measures for Tony. There are several important safety considerations that must be implemented during exercise for Tony. Episodes of autonomic dysreflexia are potentially life-threatening events, and as such, precautions should be taken to ensure that these are avoided. Firstly, before commencing exercise, it is essential to ensure that he has his GTM spray on hand to manage these events should they occur. On top of this, precautions such as avoiding overhead lifting should be taken, as this can lead to spikes in blood pressure. Should an episode of autonomic dysreflexia occur, it is important to follow the action plan as outlined in Appendix 1. Spasticity and contractures are another important considerations that should be taken into account. It is important to manage spasticity and move affected joints as much as possible, as this reduces the risk of contractures occurring and keeps muscles from excessive shortening. Another safety consideration that should be taken into consideration is the development of pressure sores. As discussed earlier, these can cause significant problems with Tony, and as such, it is important to ensure pressure is released often throughout the session, as well as providing cushioning to relieve this pressure. Orthostatic hypertension should also be considered during exercise. This is a sudden drop in blood pressure, usually occurring with changes in postural orientation, when going from lying to seated positions. Thermoregulatory function can also be affected in patients with spinal cord injuries, as they may suffer from abnormal regulation of body temperature due to a lack of ability to sweat. As such, it is important to manage the environment to avoid large changes in body temperature. Urinary tract infection is also of significant concern for patients with spinal cord injuries, due to a lack of ability to control the bladder and the use of catheters for bladder drainage, which can lead to bacteria getting into the urinary tract. Research conducted by Tweedy et al. In 2017 provides guidelines for exercise prescription in patients with spinal cord injuries. When developing exercise programs for Tony, it is important for us to consider these guidelines, while also ensuring we tailor sessions to both his abilities and individual goals. As such, throughout the programs, there is a specific focus on his ability to ambulate in his wheelchair. This is a priority goal for him in increasing predicted VO2 during arm crank assessments, as well as increasing his 6-minute wheel test result. Increasing Tony's ability to ambulate is also important for him to reach his goal of playing wheelchair AFL, as this requires high levels of mobilities and fast movement in his chair.
As such, we have programmed exercises in his wheelchair, focusing on improving his ability to move and turn at fast speeds, as well as exercises focusing on improving his cardiovascular endurance, such as rowing and boxing. This is performed 3 times per week initially, for periods of up to 20 minutes at vigorous intensities, according to exercise guidelines. This progresses over time as Tony's tolerance increases to be performed for longer periods and at higher intensity. Another key aspect of Tony's program is the use of functional electrical stimulation. Research by Fazio in 2014 recommends weekly sessions consisting of at least 14 to 17 minutes of electrical stimulation to increase lower limb muscle mass for patients with paraplegia. Tony is using functional electrical stimulation in both of his in-clinic sessions, with the first session focusing on resistance-type movements, including leg extensions and upright static balance. According to research conducted by Ho et al. In 2014, FES in the trunk can benefit both trunk control and pelvic tilt for patients lacking motor control in the trunk region. Further research conducted by Ibitoye et al. In 2023 suggests leg extensions using functional electrical stimulation elicits significant lower limb muscle growth. This research indicates initially leg extensions will have to be performed passively with assistance from the EP. This then progresses over time to where the client is able to independently extend their knee, with long-term progression moving towards using light ankle weights. Research conducted by Van der Scheer et al. In 2021 shows FES cycling provides benefits to muscle health, power output, aerobic fitness, muscle strength, fat mass, spasticity, and bowel health. Initial programming involves building the leg muscles to cycle with the support of FES continuously for 6 minutes, progressing towards using 4 sets of 6 minutes in each session to assist in meeting the goals for Tony. On top of this, there are several exercises aimed at building Tony's strength and mobility to assist independence. Research conducted by Sunda et al. In 2023 shows muscles in the shoulders and arms are most important in transferring and developing independence for Tony. As such, these muscles are targeted throughout in-clinic sessions as well as the home program. Spasticity is also an important consideration in Tony's program, with research by Van der Scheer et al. In 2021 showing movement of the lower limbs is an effective method of minimizing the effects of spasticity in clients with paraplegia. As such, this is addressed using exercises such as cycling with the use of FES, as well as passive stretching of the lower limbs.
The first exercise we are modifying to meet the needs of other conditions is cycling with functional electrical stimulation. Sarah Williams suffers from multiple sclerosis. An effective modification for her is the use of the elliptical trainer. This will be done according to research by Hong et al. In 2021, which recommends 2 to 3 sessions per week of aerobic training, beginning at 40 to 60% max heart rate. This reduces the risk of falls occurring, as well as provides a more functional exercise than other forms of cardio, such as cycling. During exercise, it is important to ensure the environment is cool and safe for Sarah, as well as monitoring her body temperature and fatigue throughout. It is also important to monitor for relapses and regress exercise if necessary during these periods. Jeffrey Roberts is 75 years old, suffering from a right-side ischemic stroke 2 years ago. He suffers from weakness down the left side and requires a walker for ambulation. Research conducted by Billinger et al. In 2014 shows aerobic exercise is vital for stroke patients to reduce the risk of further strokes and reduce fatigue throughout the day. As such, a recumbent bike is an effective method of this. Use of the recumbent bike allows a stable environment for Jeffrey, eliminating the risk of falls and balance issues. Before exercise, it is important to ensure a thorough warm-up due to his use of beta blocker medication, followed by monitoring of blood pressure and fatigue throughout exercise. Kenzie SM is a 10-year-old female diagnosed with spastic diplegic cerebral palsy. She has indicated that she would like to undertake swimming as she feels this makes her legs feel less heavy. Research conducted by Verschuren et al. In 2016 shows aerobic exercise is of vital importance for children with cerebral palsy. This can be done using swimming intervals, allowing her to get time in the pool as she has indicated to us is a desire, as well as improving her cardiovascular health. During exercise, it is also important to monitor her for signs of seizures, such as feeling faint, lightheaded, or nauseous, as indicated by her use of Tegretol, as well as monitoring for signs of fatigue.
The second exercise we are modifying for other conditions is Tony's 10 by 10 meter wheelchair laps. This places a primary focus on his ability to ambulate effectively, and as such, this is taken into consideration according to each individual's abilities. For Sarah Williams, we have chosen stair climbing, as this is a primary area of concern for her, and something that she does every day around the house. Sarah should aim for 2 to 3 laps up and down a set of 12 stairs initially, progressing as she develops capacity. She should then rest for 2 to 4 minutes to reduce fatigue and perform 3 rounds of this. While going up and down steps, it is important to spot her to reduce risk of falls, as well as providing railings should she need to hold on to assist. In the case of Jeffrey Roberts, his main concerns in regard to ambulation are around step length and hip flexion and extension. As such, we'll be using an obstacle course that places a focus on this, using things such as markers on the ground to promote step length, as well as hurdles to force hip flexion. This will be performed in approximately 60-second rounds with 2-minute breaks between to reduce fatigue. It is also important to spot Jeffrey on his left side, as he is likely to fall to this side due to his weakness. Similarly, Kenzie Assam will perform an obstacle course. However, this places more of a focus on walking speed and standing balance. When doing this, it is important to consider that she is 10 years old, and creating an obstacle course is a way to keep her engaged and enjoying the session. As such, exercises should include things such as balance while using technology such as blade pods or other game-type situations to make the session fun for her. When creating the obstacle course, it is important to avoid fast movements, particularly in the lower limbs, to minimize the effects of spasticity, as well as spotting to minimize the risk of falls.
Thank you for taking the time to watch my presentation on Tony. My reference list is outlined here.